Welcome, medical students, to today's lecture on biliary tract disorders. In this comprehensive script, we will delve into the intricate details of various conditions affecting the biliary system. By the end of this lecture, you will have a solid foundation in understanding the functions, pathophysiology, clinical manifestations, diagnostic approaches, and treatment options for these disorders. So, let us begin. The biliary tract plays a crucial role in the digestion and metabolism of fats. It is composed of several essential components, including the liver, gallbladder, intrahepatic bile ducts, extrahepatic bile ducts, and the sphincter of Oddi. The liver produces bile, a substance necessary for the emulsification and absorption of dietary fats. Bile is then transported through the intrahepatic bile ducts, which merge to form the common hepatic duct. From there, it enters the gallbladder, where it is stored and concentrated until needed for digestion. Cholelithiasis is the formation of gallstones in the gallbladder or bile ducts. Risk factors include obesity, rapid weight loss, and certain medications. Symptoms include severe abdominal pain. Diagnosis is done with ultrasonography. Treatment involves dietary changes, medications, or surgery. Cholecystitis is inflammation of the gallbladder due to obstruction by gallstones. It causes severe right upper abdominal pain, fever, and leukocytosis. Complications can be serious. Diagnosis can be made using ultrasound and CT scan. Severity assessment is important for management decisions. Cholelithiasis refers to the presence of stones in the common bile duct. These stones may migrate from the gallbladder or form directly within the bile ducts. Obstruction of the bile duct can lead to jaundice, pancreatitis, and cholangitis. Diagnostic modalities include ultrasound, CT scan, magnetic resonance cholangiopancreatography, MRCP, and endoscopic retrograde cholangiopancreatography, ERCP. ERCP not only aids in the diagnosis but also provides therapeutic options, such as stone extraction or stent placement, to relieve biliary obstruction. Biliary dyskinesia refers to abnormal gallbladder motility or functional disorder. Patients may present with symptoms suggestive of cholecystitis, such as right upper quadrant pain, nausea, and bloating, despite having a normal gallbladder on imaging studies. Diagnostic tests include hepatobiliary scintigraphy, HETA scan, which measures gallbladder ejection fraction and assesses motility. Treatment options for biliary dyskinesia include dietary modifications, medications to improve gallbladder emptying, or surgical removal of the gallbladder, cholecystectomy. Primary biliary cholangitis, PBC, is an autoimmune disease characterized by progressive destruction of small intrahepatic bile ducts. Histopathological findings demonstrate granulomatous destruction and lymphocytic infiltration. Patients with PBC typically present with fatigue, pruritus, jaundice, and hepatomegaly. Diagnostic criteria include biochemical markers, such as elevated alkaline phosphatase and antimitochondrial antibodies, AMA. Management strategies include ursodeoxycholic acid, UDCA, to slow disease progression, symptomatic relief, and liver transplantation for end-stage disease. Primary sclerosing cholangitis, PSC, is a chronic inflammatory condition that affects the medium and large-sized bile ducts. It is strongly associated with inflammatory bowel disease, particularly ulcerative colitis. PSC patients have an increased risk of developing cholangiocarcinoma. Diagnostic approaches include imaging studies such as magnetic resonance cholangiography, MRC, and endoscopic retrograde cholangiography, ERC. Therapeutic options for PSC are limited, with liver transplantation being the definitive treatment in end-stage disease. Choledochal cysts are dilations of the bile ducts due to developmental abnormalities. They can cause complications like cholangitis, pancreatitis, and biliary obstruction. Clinical presentations range from mild discomfort to severe symptoms. Surgical intervention is important for managing choledochal cysts. Biliary atresia is a progressive and idiopathic obstruction of the bile ducts, leading to bile flow impairment and subsequent liver injury. Clinical features include jaundice, acolic stools, hepatomegaly, and progressive liver disease. The diagnostic approach involves an evaluation of serum liver enzymes, liver biopsy, and an imaging study called the hepatobiliary aminodiacetic acid, HIDA, scan. Management options for biliary atresia include the Kasai procedure, a surgical intervention aiming to restore bile flow, and liver transplantation for patients with advanced liver disease. Biliary strictures refer to the narrowing of the bile ducts, which can result from various etiologies such as trauma, inflammation, stones, or iatrogenic causes. Diagnostic techniques include imaging studies like magnetic resonance cholangiopancreatography, MRCP, and endoscopic retrograde cholangiopancreatography, ERCP. Biliary strictures can be classified as benign or malignant, and treatment options differ accordingly. Benign strictures may be amenable to endoscopic or surgical intervention, whereas malignant strictures often require a multidisciplinary approach, including palliative measures and consideration of resectability. Biliary neoplasms are tumors originating from the biliary tract, including cholangiocarcinoma, gallbladder carcinoma, and ampullary carcinoma. Clinical features vary but may include jaundice, weight loss, abdominal pain, and palpable mass. Diagnosis involves imaging and tissue sampling, while treatment includes surgery, radiation therapy, and chemotherapy. Alcoholic liver disease, caused by chronic alcohol consumption, can lead to various complications involving the biliary system. The pathogenesis involves acetaldehyde toxicity, oxidative stress, and genetic susceptibility. Alcohol-related biliary complications include cholangitis, cholelithiasis, and specific associations with primary sclerosing cholangitis. Early intervention in alcoholic liver disease is crucial to prevent irreversible biliary damage and improve patient outcomes. Strategies include abstinence from alcohol, nutritional support, and medical management to mitigate the progression of liver disease and associated biliary complications. Understanding biliary tract disorders is crucial for accurate diagnosis and management. Topics covered include cholelithiasis, cholecystitis, cholelithiasis, biliary dyskinesia, primary biliary cholangitis, primary sclerosing cholangitis, choledochal cysts, biliary atresia, biliary strictures, biliary neoplasms, and alcoholic liver disease's relationship with biliary complications. These complex disorders require a multidisciplinary approach with clinical evaluation, diagnostic tests, and tailored treatment plans.